Ontario's new as-of-right rules are exactly the kind of innovative solutions we need. They're going to bring much-needed reinforcements to the front lines of our healthcare system. So to nurses, doctors, and healthcare workers across Canada, if you've been thinking of making Ontario your new home, now's the time to make that move.
CBC's Megan Fitzpatrick joins us now live from the provincial legislature in Toronto. Megan, Premier Ford and his health minister made the announcement earlier today. What exactly is involved here?
Well, they say they will introduce legislation next month. MPPs aren't sitting right now at the legislature, so it sounds like they'll do this when they get back here, Natasha. And as you heard a bit in that clip there from the Premier, they say that, excuse me, this will allow healthcare workers who are registered to practice in other provinces and licensed to practice there to move to Ontario and start working here immediately without having to first register with the regulatory body that oversees their profession, be it the College of Nurses or the College of Physicians and Surgeons. It wasn't clear in their announcement, Natasha, but we have followed up and learned that eventually they will have to register with the appropriate body in Ontario, but they'll have up to 12 months to do so. And again, Premier Ford saying this is all about cutting red tape. Here's a bit more of what he said about it and the pitch that he's making to healthcare workers outside of Ontario.
We need as many people as possible. We're trying to recruit right around the world, but just a message to all Canadians. We welcome you with open arms. You won't have to go through any bureaucratic red tape. You arrive here with your credentials. We'll find a job immediately for you.
Now, Natasha, there's still a lot of questions to be answered about how exactly this will work in practice. I mean, just for nurses, for example, when they come to work in Ontario from another jurisdiction, they have to write what's called a jurisprudence exam to demonstrate that they understand Ontario's laws and standards of practice. Not clear if people coming under this new legislation will be able to skip that exam, what it means for the people that are already in the queue to get registered and licensed in Ontario. Do they get to skip the line as well, or what happens? So a lot of unanswered questions that hopefully we'll keep asking and trying to get some answers from the government, or perhaps we'll just have to wait for the details that will be contained in the legislation next month.
Okay, CBC's Megan Fitzpatrick in Toronto. Thank you. So let's get some of that reaction now with Doris Grinspun. She is the CEO of the Registered Nurses Association of Ontario, and she's joining us from Toronto. Doris, good to see you again.
Good to see you, Natasha.
So Doris, you heard my colleague Megan talking there about this new legislation that's going to be brought forward by the Ford government in Ontario. Good, bad, ugly? What are you hearing from your colleagues in nursing?
Well, first of all, it's not the solution. That's the most important thing. Natasha, you interviewed some time ago our internationally educated nurses that, like the Premier says, we welcome them to open arms here in Ontario, and they're still waiting on the sidelines. Thousands of internationally educated nurses that made Canada, made Ontario their home, waiting on the sidelines. So we have the nurses. We also have new graduates that come to graduate in Ontario and exit Ontario. What the Premier forgot to say is that bringing nurses is not the only solution we need. Is keeping them in Ontario that is the problem. So why would nurses from another jurisdiction come to Ontario, that is Toronto or other cities in Ontario, but Ontario overall, one of the most expensive jurisdictions in Canada, and the second lowest paid in the country. The Premier forgets that. The Premier wants to continue to bring people, but then he's not willing to continue to pay them the way it needs to be. So the issue is announcements are good, but what Ontarians need, Premier, is a solution. You mentioned today, Premier, that doctors, you negotiated like this, and great. We want the same for nurses, so we keep them in Ontario. And then if we attract more, let's be careful from where in Canada. We do not want to steal, Natasha, from jurisdictions that may need more nurses than us, like Nunavut, etc., that are struggling always, not just now, post-pandemic.
Doris, I hear two clear things there. One is that it doesn't really address the shortage, at least on a nationwide spectrum, and the other thing is compensation and fairness. So let's talk about the shortage. So even if a bunch of nurses from other provinces move to Ontario, then you create a potential problem in the other locations. In Ontario, if we have all of these nurses coming from overseas in different countries, what's the problem? Why aren't they working as nurses? What's the roadblock there?
The roadblock there is the speed by which we process their registration, the speed. And yes, we have done, and the Premier has also enabled with the Minister aspects like language. I mean, nurses that know English perfectly still used to have challenges here. So that has been addressed. But still, the speed of registration is very, very slow. And that's really the barrier. But the biggest barrier, Natasha, is to keep them in Ontario. That's the biggest barrier. So probably what the Premier is trying to do here in real terms is to save money on education of nurses, the 4 years of education if they study here, but then they're going to leave anyways. They're going to continue to leave until compensation and workloads are dealt with.
Okay, so from the Premier's perspective, I mean, if you're the Premier of Ontario, you can't really worry about BC that much, or Nunavut, or whatever the case may be, so you've got to worry about Ontario. So I hear you in that, hey, someone else educate them and bring them over here with their skills. But let's talk about the other aspect you brought up, which is compensation. Are you able to do a compare and contrast to what nurses are paid here versus other locations, and why we fall lower down the line?
Absolutely, Natasha. So when you look at the first 3 grades of nursing, so year 1, year 2, year 3, post-graduation or internationally educated nurses that join the workforce the first 3 years, and the question will be also about those coming from other jurisdictions, Natasha, will they keep their seniority? I doubt it. So they will all start at level 1. We, on the first 3 years post-graduation, are the second lowest jurisdiction in the entire nation in terms of compensation. And it's something I have said to the Premier and to the Minister and others at the government. The second lowest in one of the jurisdictions that is the most expensive. That is the key barrier. That's why people don't stay. And that's why I don't think this will be a solution. They will not come either. Unless they have family and they need to transfer, but that always happens. You don't need to make this big announcement for that, right? So it's not that we have issues with the announcement per se, because ideally, Natasha, will be good to have one registration for the entire country, quite frankly, and then just very small specifics about jurisdictions. But ideally, the exam is the same, the process is the same. It should be one registration across the country. But that's not the solution specific to Ontario now. We are the lowest paid and it's due to Bill 124. And as you know, Natasha, the Premier decided, unfortunately, I was very hopeful will not be the case, but he decided with the government to appeal the court decision that deemed Bill 134, the bill that kept compensation for all these years at 1% capping. And the court decided that is unconstitutional. The Premier decided to appeal that court decision. So that tells you right there that the Premier is not being fair or serious with nurses here. So to say we welcome you with open arms is fabulous, but we want to keep you nurses and we want to keep you doctors and others with open arms, and that's where the Premier should focus on.
Okay, we'll certainly reach out to the Premier's office to get his response on that. But in the meantime, Doris Grinspun is the CEO of the Registered Nurses Association of Ontario. Thank you for your time, Doris.
Thank you very much, Natasha.